Hello dear friends. So in this video, we are going to talk about my patients who come and ask me this golden question that doctor, I have passed many years after the tooth extraction and is it the right time to place dental implants for me? Hello everyone. My name is Dr. Dheeraj Punjabi and I'm your implant specialist at Dental Crafts Govandi. So why do our patients delay for dental implants? There are few reasons which I can cite you over here. The first reason is the fear of pain. Most of the patients understand that any dental procedure is associated with a lot of pain, but it's not anymore. With the advanced techniques in anesthesia, we can actually finish the procedure in minutes. As well as technology is also helping us to place implants through a very small keyhole in a matter of around 15 to 30 minutes. The second reason what they talk about is money. So there are dental implants which are available in the market starting from the cost of 10,000 rupees to 1 lakh rupees, and money has always been a concern in this because when you go for something best, you need to put money, and what patients call it as a cost, I call it an investment in your health. The third reason is the misconception that bridges or dentures, which are substitutes for a dental implant to replace missing teeth, work very well. But a lot of studies have showed that over a period of time that bridges and dentures have a limited life period. Also, the serving efficacy starts reducing year on year. So the kind of health what you can enjoy with dental implants is not completely available with the other options like dental bridges and dentures. The next reason why patients can delay this is lack of time. Patients are very busy and they are involved in their day-to-day activities, taking care of the career of their loved ones, or they are taking care of parents' health, or they are taking care of their jobs where they forget to take care of themselves. So in this regard, I always tell my patients to come in for a checkup every 6 months so that we can address any concerning issues and we can give them the best possible solutions available. So I have had patients who have waited for around 5 to 10 years thinking that my gums and the bone will get better on their own. But that's not true, because when we see the patient year on year, there is something called as loss of tissues, which is the gum and the bone, which was supporting the previous healthy tooth in the mouth. So as these tissues shrink, it becomes very difficult for us dental surgeons to do an effective job and place a stable implant in that position. So there are consequences of these tissues like gums and bone shrinking, because implant is a substitute for a missing tooth and it needs to be respected in its place with the help of correct jaw support, that is bone, and correct gum support, that is your gums. So now we need to do procedures in which we improve the quality and quantity of your gums and bone, where we need to place an implant if the patient has missed the treatment for the last 5 to 7 years or maybe sometimes 10 years. So it's not that it's not possible, it is possible, but with few more complex add-on procedures which needs to be done, which require time, money and effort on the dental chair. So at Dental Crafts, we make your dental implants journey absolutely simple and comfortable. So what starts in the first step is actually a consultation where we sit together and understand the needs of what needs to be done in the mouth, along with understanding what is the present condition of the teeth, the bones, the jaws, as well as the gums. Next comes a 3D guided treatment planning, which I think is the birthright of every patient. Due to technology, we are able to do this 3D planning, which is very similar to seeing a 3D reconstruction of your house being decorated by an interior designer. So this 3D planning allows us to place these implants in the correct position and a very stable position, which will lead to higher success rates and stability over the years in the future. So talking about the procedures, They have also become very simple thanks to the technology again, where we can just have keyhole procedures done with the help of stents, which are called guides. Now, these guides are prepared by a technology in which we use the CT of the jaws, as well as our software does the planning. And this software enables us to fabricate a guide, which is then placed in the mouth, through which we can place the positions in a correct and precise position, and thus ensure a long lasting tooth which will be coming over the implant. So if you have delayed your implant journey in the last 5-10 years and you think you are not a candidate, get yourself screened by your dentist. That's the first thing. The second thing is, please ask for something called as a 3D planning, because that's the right of every patient. Now, if you are someone who wants to start this journey and don't know how, I have a free downloadable book which I can just give you in the comment implant in the comment section over here, and I will make sure that I will send you this downloadable book, which is available, and it is giving you all the relevant questions which my patients ask in the consultation, and you can make a decision after reading or going through this book whether you are a suitable candidate for dental implants, even if you have missed the treatment in the last 10 years. So I will be waiting for your comments down there, and do get in touch with us if at all you have any more queries about dental implants. This is Dr. Dheeraj Punjabi signing off. Thank you very much and keep smiling.